the state and like the drive-through one. I'm really a little concerned. I am a little concerned with my TV. Well, everybody's gonna get a free test, so I'm just gonna drive up to the free test place and get that thing rammed in my nose. I don't agree with it. I would beg anybody, if you don't have a temperature and you're feeling okay, please don't go do the free test or don't go to the drive-through and get the thing, the swab rammed up your nasal cavity. The people doing it are fantastic people, but imagine you're the 200th car in line and they've been wearing the protective gear, right? What they're doing, they drive up, do this, drive up, do this, drive up, do this, drive up, do this. Are they changing this every single time? The more people that go through that line and the medical technologist like myself performing the test on somebody, if you're the 200th person in line and I'm not changing my gloves every patient, I'm not changing my gown every patient, but I'm the one doing that, the more times I touch somebody and you're the 200th person, you just shared the germs of 200 people, even though you're trying to get a culture from one person and you're feeling fine. So the testing really should be for people that have fever, 100.6 they said, 100.9 and 65 and up, 100.6 and 65 and up, painful cough, even a dry cough. Those were the big things as far as if you've been to a country or on a cruise or contact with someone with a known COVID positive test already. Those were the people that should be screened. My fear is that everybody wants their free test at the drive up at Walgreens or wherever where you got a tech out there. These are not, they're wonderful people. I'm sure that they're skilled at doing the test. But if 200 cars go through that line, and I'm sure they change their gloves, I'm sure they do, in between every patient, I'm sure they change their gloves, I'm sure they change their jacket or their protective gear as you roll down your window and they stick it up your nose and your kid's nose and your husband's nose. I'm sure they do that. But the more times you come in contact with that person, the higher the chance of you getting corona or any other virus, like touching your face. Masks. The masks are for people that test positive and have corona. The people with corona should wear the masks. That's protecting the rest of us from getting the secretions. It's only spread by droplet. The only one, tuberculosis. If I'm just talking, in this, I have tuberculosis. I can infect this whole room with tuberculosis. That's why they have to be quarantined strictly, because that can float in the air. TB can float in the air and you can breathe it. The coronavirus, so far from everything that's been out there and readable, it is a droplet. I cough on myself, I hand you a soda, or tongue kissing, saliva, sharing the same fork, sharing a soda. It's got to be contact. Contact precautions need to be taken. Contact precautions are wash your hands when you go into a new room. Every patient, wash your hands. You come in contact with the doorknob, we're wiping them down every 20 minutes, which is really great. So this has to be contact. It has to be droplet. It's got to be a droplet of mucus you rub in your eye, pick your nose, or stick in your mouth. That's how it's being spread from everything so far. It's not in the air per se. I know they're saying keep 6 feet apart, which is good. If someone sneezes, you see how far that can go farther than 6 feet. But the fear can really calm down, and the temperature in the whole room can come down with the knowledge of 97% survival rate for the most part. If you've got asthma, if you've got rheumatoid arthritis, if you're taking immunosuppressive drugs, you're at a higher risk if you get it of becoming sicker. Now, if we're getting sick or starting to get sick, they can still do very well and survive even the corona. Vital signs are vital. That's the most important part. If they're getting sick, we need to check their O2 sat. We had the ambulance at the office a couple of days ago. O2 sat was in the 80s, right? So when the O2 is less than 90% with a pulse ox, that meets criteria. Any pulse ox less than 90. So just to synopsize a little bit, there is no drug for the corona. Survival rate is 97%. The mortality rate is a little over 3%. The key to all of us doing fantastic is stopping the spread so we don't get that spike in cases that could overwhelm the ventilators that are available. With 250,000 ventilators, it is possible to overwhelm that system if people don't wash their hands. If they're sick, they don't stay home. It's stopping the spread that is the key to the whole pandemic. Yes, ma'am.
So for people who do have asthma and things like that, obviously we suffer with difficulty breathing more often than not. So how do you know when it's a little more serious? Do you have to have that fever? Do you have to have that accompanying symptom to know that you should do something about it if you're having difficulty breathing?
That's a really good question. Right now too, because Donovan, our boy, he's got asthma. We both have. I gave him my asthma. Yeah. So on Bay News 9, the local TV, the pollen on Sunday is 10.8 out of 12.
Yeah.
The pollen on Monday is 10.6 today. Tomorrow, the pollen is going to be 11.6. Mm-hmm. So it's such a great question because cat dander, dog dander, weather change, pollen change, perfumes, exercise, anxiety, all of those things can affect the lining of the lung and cause more secretions. So this is such a great question and so important. Vital signs are vital. That's why they're called vital, because they're vital information. Blood pressure's good, temperature's not over 100, 101, and your O2 sat on the pulse ox is 90 or above, we're good. We're A-okay. A little singular Zyrtec or a little something for our asthma, nebulizers, albuterol, breathing treatments. Now the fever with those symptoms usually command at least getting tested to know that you should shelter in place, take it easy, breathing treatments, fluids. The fluids thin the secretions, right? You've had asthma. So if I get really thick and I'm really a little dehydrated, I drink a lot of fluid because it'll thin those secretions, much easier to cough up and get rid of. Like really, really good. So that's crucially important question. That's really good. So like you said, COPDers, smokers, asthmatics. Is it the pollen? Are they wheezy from their smoking? A combination of the pollen, the dog, the asthma, and the smoking all together? The pulse ox is really important. If they're feeling that they can't catch their breath worse than normal, that triggers vital signs and just see. Mucus. The pollen is so bad right now, like it's 11.4 and with a maximum of 12. I'll bring up like clear stuff, if you cough up a bloody mucus, that should generate a chest x-ray and a visit to us, checking the pulse ox. Sometimes a little bloody mucus is pneumonia, early pneumonia. Right now, pollen season, allergy season, Haemophilus influenza A and B. So there's many other things besides just the Corona-19, which causes overlapping symptoms with kind of what's going on. So it really is up to people that have been doing it 25 years or 20 or whatever, because that's when the vital signs are so important. And the clinical decision making, who should get it tested, not. There are instructions on the CDC website. You've been on a cruise. You've had exposure to someone with known COVID-19 even in and around. You got a fever over 100. You're a little short of breath. That could trigger just going to get a test. Great. Never treat the paper, treat the patient. You then go, get a test. Oh my God, I'm positive. Oh my God, I got the Bola. Not the Bola, but the Corona. So I'm positive, I tested positive for Corona. Such a great question. That triggers me going home, staying in my room, staying in touch, Facebook or us talking, vital signs, fluids, Tylenol, watch some movies, chillax. 80% or more will get better dramatically, and 14 days they're good. So that's if we're slipping backwards. Hey, I'm really coughing up thicker stuff now. I'm having a little trouble. That generates the trip to the hospital. That's a great question. When do I know to go? When am I getting sick enough? Well, that's what we're here for too. All of us to talk to each other. Hey, I'm walking just to the door and I'm getting short of breath. I never had that before. I'm walking not even the city block and I'm having trouble breathing. You know, it's the gestalt. It's the temperature, pulse, respiration, O2 sat, and some clinical decision making where you kind of go, this is not just my asthma, I'm feeling worse. Any more questions we can think of?
What about diabetics? How does it affect them?
Diabetics at a huge higher risk. I mean, just diabetics with any infectious disease. I mean, any infection makes their sugars go crazy, up and down, makes it harder to treat the infection. There is no drug for this bug, even though it's a virus. So diabetics normally need to be admitted for blood checks around the clock to control their sugars so they don't go into diabetic ketoacidosis when their sugar goes, over 400, 500. Our supportive care, it's such a great question. There is no drug for this bug, so the treatment is absolutely supportive care, meaning serial exams, checking the O2 sats, making sure that they're doing okay. They should walk around, even in the room. They do exercise, Pilates and yoga and keep moving. You just shouldn't be a lump in a bed. It is like keep them moving and all that, but diabetics, again, they're immunocompromised and they get really sick really fast and they die fast with any infection. But this one is different in that it's a respiratory virus which attaches to the lining of the lung, the ACE2 receptor, which causes flash pulmonary edema, acute respiratory distress. So when that mucus is coming, those are the ones that need ventilatory support, and they can do well too. They can do well. They can't, depending on how bad their lungs are, how much they smoked, how bad is their COPD, how bad is their asthma, and 3% are gonna pass away. 3% are gonna pass away. Right now, in South Korea, the death rate was 0.7. In South Korea, the death rate was 0.7. Some of that is biostatistic because they tested so many people. They've tested way more people than we have. So when you get 80% of people that test positive but very little symptoms, and you test 400,000 more of those, your death rate plummets statistically if you just look at the statistics. So it doesn't matter if you're 0.7% or 3%, if you're the 0.7% or the 3%, it doesn't matter. That's why we try not to focus on just that number, but to have everybody feel better, relax a little bit and calm down. 97, I wish the TV was 97% survival rate. Yay, 97%. Now look at 3% are dying, 97% even get infected, 97%. And if it's so contagious, and there are a couple of police officers that got infected, there's a couple of ER doctors that got infected. Some of that's on all of us, right? I mean, we gotta wash our hands, use universal precautions, wear the gloves, wash our hands after each patient, and this is very, very, very beatable. We just can't handle a huge wave of the population getting sick at the exact same time because of the number of ventilators that are available. I hope that makes a ton. The 97% or more survive and do really, really good. It's not as scary when you have the knowledge on how to beat it. Anything else?
But it's in an incubation stage it can be up to 14 days, correct?
No, symptoms occur once the virus gets in you. In 2 or 3 days, you start experiencing some of the fever, the cough, the chills, or a little wheezing. Because that virus, right? The virus, it's a great question. A bacteria, it can take a little, longer. Bacteria it's an organism, right? It can live. The virus has to get inside your cells, take over your cells' machinery to make more of itself and spill in the runny nose and the cough and the mucus. A virus, an RNA virus, is an obligate intracellular disorder. It has to get inside your cells to take over your DNA to make more of itself. That's pretty, from the time you touch anything or from the time you contact it, within 1 to 14 days, you'd be really sick. It can live on a surface, they say, for 3 days. Like 3 days if we don't wipe the surfaces down, but it can live onto a surface for 3 days. That's about the lifespan for just if someone coughs or sneezes on the surface. That's why we wipe everything down, and someone got rid of all the calendars, I like the calendars, but they had to go. We couldn't clean the calendars, so we had to get rid of the calendars. But this is very beatable. It's going to be fantastic as far as we will win. But the absolute key is use our head, stop the spread. Use our head, stop the spread. What South Korea did was they tested like in everybody. They tested like crazy. You tested positive, you're staying home. That was the one tactic that they're trying to replicate right now with the number of tests. But everybody got so scared, or on TV and the toilet paper and filling there. It's fine, I get it. But if you test positive, 80% do fine. 80%, 80% do fine. Even if they test positive, it's not a death sentence. I just don't want people freaking out. Even if they test positive, 80% of the time, just with supportive care, they get better. I think the fear is, oh my God, I tested positive, I'm gonna go jump off the skyway, it's over for me. No, this is really treatable, even though there's no drug for the bug, it's very treatable. It's very treatable. Even if we test positive, 80% get better by themselves, 15% end up in the hospital. Of that, 3% will pass away because they have underlying, usually lung issues or health issues or immune issues or rheumatoid. They've been taking steroids forever. Their immune system has been depleted. Even they can do well with great supportive care. Even many of them can do well with great supportive care. So from the time of touching the counter with the droplets, you eat a sandwich, 2, 3, it varies a little bit person to person, but usually within 7 days, you would have symptoms from the contact of that disease-causing particle. Any questions or more questions? Did that sound pretty good, or did that help like relax a little bit? Did that help?
Yes.
Yes,
Like-
of course. Very important.